enter the room.
Hello. Hello.
Hello.
I'm Dr. Nassar. Are you Sheldon Gilbert?
Yes, that's me, doctor.
Yes. Nice to meet you. Can I confirm your age, please?
I'm 50.
Can I call you Sheldon? Is it okay?
Sheldon's fine.
Okay. I understand, Sheldon, you are here today for follow-up, and you have a discussion about your blood pressure.
Yes, I had a couple of tests done, so
Yes.
I've come to find the results.
Yes. Can you tell me what do you know about the test you had and what the doctor told you? And can you tell me about what happened before you today?
Oh, this is my routine checkup. In
Yes.
fact, my wife and I were watching a TV program, and it was very nicely mentioned that annual checkups are very important, especially for anybody at the age of 40. So that's why I got these tests done.
Okay. So do you have any worried why you want to do this checkup? Do you have any concern? You want to do this checkup specifically so I can address it?
Not really. I'm just, I just came for the results mainly.
Okay, do you mind, I have the result here with me, and but do you mind if I can ask you some questions to discuss, to have more idea about your health?
Yeah, sure. Go ahead.
Okay, before you coming here, have you experienced any symptoms like racing of the heart, chest pain, anything?
No, not really.
Okay, any cough?
No, not really.
Okay, tell me more about your. Have you been diagnosed with any medical condition before?
No, doctor. I'm generally pretty well.
You have been fit and you haven't been diagnosed with any medical condition before.
No, not really, not at all.
Okay, have you been taking any medication or supplement?
No.
Okay, any medical problem in the family?
Not that I'm aware of.
Okay, do you have diabetes, anything like that before, or in the family?
No, doctor. Not that
Or
I know of.
no, cholesterol, high cholesterol?
No.
Do you smoke?
Occasionally, yeah, I do.
Okay, how many cigarettes?
Well, sometimes around 26 a day, otherwise maybe just once, but whenever I feel a little stressed, work gets me stressed.
Okay, that means 26 cigarettes usually per day.
Yeah, sure. You could say that.
And what about drinking?
Well, I have like about 2 glasses of wine a day.
2 glasses of wine a day. Okay. Do you know this is more than the limit? The limit is 14 units per week.
Oh, is it? I wasn't
Yes.
aware of it.
Okay, thank you for answering all these questions. Now I want to ask you about who do you live with?
Oh, I live with my wife, actually.
Okay. And do you have children?
I do. I have 2 grown boys.
Okay, that's good. That's good. Tell me more about your diet. How you eat? Is it you cook or you buy ready food?
Well, I end up eating out most of the time. I'm a businessman, so job usually keeps me away.
Okay. And what do you eat normally?
Well, Sometimes fast food, sometimes whatever I'm craving.
And what about exercise? You made exercise? Have you regular exercise?
Unfortunately, work doesn't allow me that. I don't really get to exercise.
Okay. Okay. Now I want to discuss you the result. I have the result here. We had made the blood pressure monitoring, and your blood pressure is slightly above the normal. It's above
Oh,
the normal, and I think you need uh, to have uh,
mhm,
medication for that. So, can I ask you? Originally, where are you from? Because for the prescription need,
mhm.
where are you from originally? Are you
I'm
white or
2 minutes remaining.
what? Can you describe yourself?
well. I'm from here.
What? Why? Which ethnic group?
Oh, Caucasian doctor.
Okay. I think you need to have a drug called ACE inhibitors first, and to decrease your blood pressure. Also, you need to change your lifestyle and your diet. Also, you smoke a lot. I think all these factors are in the future will affect your cholesterol and will affect your heart and your blood vessels. So you are a risk of heart attack if you cannot change your lifestyle and diet. Does that make sense?
Wow, heart attack. All
Yes,
right.
yes. I'm sorry to tell you that, but the truth, you are blood pressure is high. You have a risk of high blood pressure. You have a risk with smoking, and you don't eat healthy. I'm sorry to tell you that, but I'm here to support you. And you drink more than the limit. So we need. I will give you link uh, to to start healthy lifestyle by stopping smoking and decrease drinking. Also, you need to do some exercise and you need to cook your food on your own because you need to eat healthy. And I also will order some investigation regarding your cholesterol level, your kidney and liver function to check what is going on more. Okay, what do you think about this?
I don't know, doctor. You're giving me so much information together. It's hard.
Move on to the next station.
I hope it's good, better than this.
All right, good job, doctor. I guess there are a couple of refinements that you can make when it comes to actually pointing out these issues. One thing is that you repeating yourself a lot. So
Yes.
when you repeat yourself, you waste a lot of time, right? And every time you talk without, including the patient, understand that you're going to lose a lot of interpersonal skills. I mean, marks on that. Because every time you see yourself talking for more than 2 minutes, I mean, you're not even involving the patient at this point, and you only give chunks of information. They can
Mm.
only retain so much, right? You're trying to understand whatever you tell them. Are they following you? Right? You're not just trying to bombard them with information. You're trying to make sure they understand what you're trying to say. At what point do you understand that he understood anything that you were trying to say? I mean, that's what, no, when
I
you're
asked him, do you have any concern? Are you following that? Okay. But I have to finish the topic as well. If I don't reach the management, I will lose mark as well.
but then you reach the management at 1 minute. I mean, how much can you actually manage to fit in 1 minute? So, see, you have 4 marks for data gathering, you have 4 marks for management. And this is a counseling case. So, you have to spend more time in management. You ended up asking so many questions, and you ended up repeating so many of the questions. And that's
Like
what, no,
what? Like
the
what repeating?
Right. So when you are so first you asked me about lifestyle. I mean, you asked me about if I have any medical conditions. You asked me if I have my family has any medical conditions, and then you asked about does anybody in your family have diabetes or your. I mean, that's two questions. Like you're actually repeating yourself. So tension behind asking every question should bring you a little more closer to management. Keep that in mind. All right. The reason why you're asking questions is to understand if it is relevant, because at this point you have a task. This is a counseling case, right? You have a task where you have a BP which is high and you have a curious score. So this is the main thing you've ignored, and a BMI which is high. All right. So you are trying to see all the risk factors that are there in his life to bring back in management. All right. So what is QRISK score? Let's talk about QRISK. A lot of questions have been coming around QRISK. So guys, do we have any opinions on what is QRISK? Anybody? So QRISK is a score that you actually
Sorry,
determine.
can I try?
Yes,
Sorry, I was
absolutely.
trying to navigate between the marking and the thing, but I think Keurig score is a calculation of someone's. They take someone's information like their weight,
Cardiac.
their blood pressure, and then calculate it to tell their risk of having a cardiac problem in the near within 10 years, something like
Absolutely.
that. So there are
Absolutely.
risks of complication within 10 years. And
Absolutely.
the higher the risk, the more problematic it is. So they will need intervention to be done, and that will be tailored accordingly.
Absolutely. Good job, Dr. Ibrahim. That's absolutely true. So it is the, score that determines the risk of cardiovascular event in the next 10 years. And cardiovascular can be anything. It could be stroke, it could be a cardiac event, anything, right? Anything that can actually throw a clot anywhere in the body. So that's what you're trying to look out for. First, you are some symptoms regarding any possibility of him having that, because he has a QRS score of 16. So the normal QRS score is supposed to be less than 10. Now, if it's between 10 to 20, it's moderate. So this is a moderate QRS score. And for a severe one, if it's more than 20. So you're looking for any subclinical signs. This is actually a subclinical sign of a very unhealthy, cardiovascular system. So technically, he might not really have any symptoms, but you're just trying to quickly rule it out. So the good start where you actually started with, could you tell me a little bit about, why you had these tests? That's a very good way, because he's got a lot of tests. He's got BP and he's got, QRISK and he's got BMI. And QRISK involves a lot of things. It could be lipids, it could be BMI, it could be a whole lot of things, right? There is a lot of tests that is done to actually come up with this number. All right, there's, I think it's called Cox regression that they use to calculate it, but they actually put in a lot of, parameters in order to come up with the score. So that's why you were just going to ask him, why have you gotten this test done? So you would realize that this guy has actually come for a routine test. So with that itself, you understood that he's not you won't expect to find any positive symptoms. So quickly rule it out. So quickly ask, have you been having any episodes of, dizziness or facial weakness or any chest pain? And if he says, yeah, no, nothing like that, I've been absolutely fine. Yeah, cool, done. Now next, understand how his lifestyle is, because that is the main point. You asked me a lot of questions regarding all these, the symptoms, because at this point you also realize that he had no reason to come here apart from the routine checkup. So he might not really have any pressing symptoms, but knowing his score, knowing the high BP and knowing his score, you want to just quickly rule them out. So just ask a few questions around it. All right, chest pain, any facial weakness, any weakness in the body, have you been feeling lethargic? And if he says no, 2 to 3 questions is enough. And then move on to lifestyle, because that's where you will get. Yes, doctor. Dr. Nasser, you want to say something?
Yes, yes, I'm following you.
All right. So after you've asked those questions, now you need to identify what all are the risks in his life, because this is a counseling station, meaning you are needed to spend more time in explaining him how to lead a better life. For that, we need to understand everything that is wrong with his, lifestyle currently. So start with PMAFTOSA, so which is past medical history, medication, family history, identified everything is negative. All right, now go on to lifestyle. How is his diet like? Does he exercise? Smoking, drinking habits? Everything is positive in that. And then try to understand little stressors in his life, like what is his occupation. You never came to that part. That's a major part. Exactly. But I offered you that information, like I'm a businessman and all that. So understand what all are his stressors in life, because they also contribute to ailments. He has a high BP, so he might have some major stressors in life. So try to understand that, right? Once you've identified all this, now go on to say, all right, thank you for answering my questions. And I have your results here with me and I'd like to discuss them. Go ahead. So so from here, so what we have done, we took your blood pressure and, over 24 hours. And unfortunately, we've seen that that's a little higher than expected. Don't have an accusatory tone. You seem to be, pointing out that, what you're doing is wrong. It's say it in a way where you would be like, what you're doing might not, might affect your life in a very negative way, right? Don't ever say that, that's where the interpersonal skills comes in. So if you're going to say it in a way where it sounds offensive, like, you're drinking and that's wrong, you're smoking and that's bad, like, so that's what, no, you should say how it is bad. You actually say that it's going to affect your life in a bad way, it can worsen these conditions. That's contributing to, what you're trying to say, rather than just saying bad, because that kind of sounds a little
You're right.
right. So identifying those things were very good, very important, and your data gathering was pretty spot on. So now coming to management. Now management needs to be tailored according to what you have understood about this patient. So start with, so we did this test, and this test was 24 hours to check. Okay, Dr. Nisu, you have a question? Please go ahead.
Will we examine the patient or not in follow-up case?
I'm sorry, could you please repeat that?
We would examine the patient or not in this case.
In this case, you already have the results. So this is all BP examination. These are the examinations that you already have. So he's on a follow-up. So in this case, you might not need to examine this case.
So we would not do any head-to-toe examination or any CVS or neurological.
I thought this is his last week, the last time he presented. Those were the findings. So he's coming for a follow-up today.
He's coming for, yes, he's coming for a follow-up.
I guess we should check.
So what happens when why do you do a BP measurement, like a 24 BP measurement? What's an ambulatory BP and what is a hospital BP? Can anybody shed some light here? When do you do that?
When we are trying to diagnose hypertension, number one, and number two, we are also trying to see that it is not hospital related. Like some people, when they're in the hospital, they tend to the blood pressure is high. So they want to see in their normal day, what they do in 24 hours, if they are anxious, if they are stable, if they are whatever, happy or sad, how is the blood pressure? Then we'll be able to take an average and know what it is, and that we can now use as to say, okay, this is it. Then we can now say if it is high or no. But some people could have what we call white coat hypertension when they are around health workers.
Absolutely, Dr. Abraham, as usual. That's absolutely correct. So basically, if you do a BP right now, what if it's higher than what it is right now? Would you actually diagnose him as some other type of hypertension? No. The definitive in this case is actually to do a 24-hour ambulatory BP, and you're coming with that. But you mentioned, would you do a CVS examination? Actually, yeah, I would actually do a CVS examination. That's a good one. Why not? because he is in front of me. I know his BP. I know that if I do the BP again, it might not come the same. So I might not do the vitals, but I would look into his cardiovascular system. Because if I do get like, rhythm that is off, I definitely would want to suspect, something worse. Yeah, if that is a question that is arising, definitely I'll do it. That's actually a good point that you brought up, Dr. Nisu. Right. But that's what you have to think. What would this investigation yield? Like, if I do this investigation, is this useful in this case for me? Right? Because if I do BP after getting a 24-hour BP, it's not really useful for me. Right? But if I'm thinking of CVS examination just to rule out any additional heart sounds, yeah, why not? I'll do that. But yeah, go ahead. But the main thing is that, this patient is actually technically asymptomatic and without any, issues. So in this case, because of the lack of time, I may not include it personally, because I have to give a lot of, lifestyle management. But if you personally feel it is important, you should do it. Like I said, you have to tailor your consultation from what you're thinking. Right? If you think it's important just to rule it out because the patient is in front of you, go ahead. Please, with all means, do it. Right? But understand what the scenario is. The scenario is trying to make you, talk to him about his lifestyle, mainly because his Q risk is high and there will be, a lot of things to talk about there. Yeah. So, but yeah, if that is something that you are finding that should be important for your management, by all means, go ahead. All right, so let's get back to topic. So, yes. So the other factors that you've understood that the lifestyle is such with a lot of risk factors that this patient has been having. So now bring it back in management. So, like Dr. Sheldon, we have done, we monitored your BP for 24 hours, and unfortunately that has come high. And we'd like to give you some medications to lower that. All right. So you went into asking me whether I was, my, the life, the ethnicity. Okay, that's actually a good question, because definitely you would give a different management for Afro-Caribbeans, and you would give anybody with age of more than 55, and Caucasians you'd be giving different. I understand that where that came from eventually later on, but I'm not really sure how you would ask that question, because technically the patient in front of you would kind of give you a little bit of a clue. But
even if some white people have African root as well, they say that you have to ask.
You're correct. Absolutely, you could ask that. So you can quickly ask, can you please mention? So you, at this point, you need to be very sure on the words you're using. So you can't, that's what's going to eat up at your time, because that's an important question. I understand your thought process now. But, while doing the consultation, where are you from is a very random question. That will just introduce so much doubt that you will end up spending time on that a lot. And that's exactly what happened, right? Where I was like, I'm just around. What do you want to know exactly? If you're asking for ethnicity, say that. And say it with a meaningful way. Like, I'd like to just know your ethnicity so that I can prescribe you the right kind of medication. Be very clear on what you're trying to ask. Otherwise, it will eat up on your time, doctor. Do you understand what I'm saying? So, be very direct on what you want to know immediately, because if you end up, explaining yourself a lot, see,
mind is difficult to say everything perfectly.
I get that, but that's what, don't introduce that, ambiguity in your round of questioning.
Yes,
This is
yes.
ambiguous, like, where are you from is like very ambiguous.
Yes, yes. English language is not my first language. That's why.
I understand, doctor. No problem. We all completely understand. But I'm just trying to give you some tips, right? That because you never got to management at all. I mean, like you had like 1 minute in management, and this is a task that mainly is management. Understand? So
Yeah.
yeah, so he's less than 55. So you want to know the ethnicity. So definitely ask that question according to the right words, like get to the point sooner. And then talk about all the risks, and then talk about the QRIS score. Explain what the QRIS score is. This is the main thing in this station. So you never really got to the task as such, right? Like, why should he have lifestyle changes? Because his QRIS score, which is a score that is needed to determine whether or not you could have any, heart or vessel related event like a stroke or a heart attack in the next 10 years, has come out to be pretty high. It's moderate at this point. You can say that. It's
I can't remember myself how we can calculate the Q risk. That's why I didn't discuss it.
you don't need to tell them how it's calculated. Just say that it is a score that is used to determine whether you will have any cardiac or vessel related adverse event. That's simple words where you can explain it in layman terms. And because it's high, we need to make sure that it is lower. So what do you do when the cure score is moderate? You actually start them on statins. All right, that is the management here. And then you also give them lifestyle changes. But the main thing in moderate cases, you give statins. You give 20 mg atorvastatin. So that's why you need to, two things are there over here. The BMI, you have to give them, ramipril or, amlodipine according to ethnicity, like you very clearly mentioned. And QRIS score on statins because it's moderate. And BMI is also high. So you have to tell them about their diet. You have to tell them that
aspirin as well.
Aspirin, no, doctor. Aspirin is only given if there is been a cardiovascular event. It's an antiplatelet. Atorvastatin it actually reduces cholesterol. So you're trying to reduce cholesterol and improve the vessel health. As of now, there is no need to give any antiplatelets at this point. So you won't be giving that. All right.
Lord, I asked him, I will do investigation, cholesterol, liver function, and kidney function like that. But
actually, cholesterol is actually done for the QRIS score, but you're correct in doing liver function, kidney function, and even creatinine kinase is also very important in this case. Because atorvastatin, before you start, you need a baseline investigation of all these things.
Even if the cholesterol is normal, in this case, I give statin.
Doctor, over here, QRIS score itself is 16.
So that I give regardless to the.
It factors in cholesterol, by the way, and it factors in a lot more things. And if cholesterol is not the only criteria to start statins in the UK, you are looking at the QRIS score for that. That's why this case is important, because not only does cholesterol determine the need for statins, it's all other supportive parameters.
Okay.
That BMI, that would include family history, that would include any diabetes status. Those are all included in this calculation. All right.
Okay.
Sorry, I just wanted to add regarding the blood pressure, since we need to treat it, and he's thinking of giving, he said he was going to give ACE inhibitors, and I think the investigations is actually supposed to have a baseline of the renal function, like to ensure the kidneys are working, because ACE inhibitors have been known to cause renal artery stenosis. So
that's not correct.
Is it? Sorry, not it reduce if they have problem with their kidneys already, it worsen it.
I understand. So you're correct. But what it actually does is it reduces the angiotensin 1 from angiotensin 2. It reduces that conversion. So angiotensin 2 actually acts upon the kidney vessels. So now what happens is if you have a EGFR of less than 45 or less than 30, that's when you stop giving these medications. In some cases, it's actually renoprotective. In case of diabetes mellitus, this is actually renoprotective medication, right?
Yes.
Strain. But the case that you're thinking is in bilateral renal artery stenosis, you don't give it. It's contraindicated in this case.
Exactly. Sorry, that was what I was trying to say. Sorry to the slip of tongue.
No
So
problem.
is there a need for us to do a
Can-
baseline?
Can you please say if you are in my place, can you say the management in your own words?
Absolutely, doctor. In fact, I have actually written different ways in how you can say the management in the workbench. So, okay. So I have it usually in the consultation guide. So if you go back to the management, explain the results, which is higher than normal, this puts you at a risk for heart problems or stroke. All right, BMI, your BMI, which is overweight category, Curie score indicates a higher risk of heart issues. All right, let's discuss the options to manage your blood pressure. What are your thoughts on starting medications or making a lifestyle change? You know, that's what, no, you always need to include them in your management. So your way of talking should be like that, right? And we can consider starting Namir to control your blood pressure. Lifestyle management, reducing salt intake and increasing physical activities are also important. Yeah, I understand you have a busy schedule, but let's find practical ways in incorporating these changes. This is how you have to say, because at one point you were like, you should cook. Like, is that necessary? That's not the management. The management is you need to eat healthy. Right, you need to focus more on what you're eating, not the fact that he should cook, right? So you need to make it sound like that. So incorporate more foods and vegetables in your diet is very beneficial, right? Quitting smoking and reducing alcohol can significantly improve your health. See, that's a good way to actually put it. And aim for at least 30 minutes of moderate exercise most days of the week. Even small changes like taking stairs can make a big difference. That's also exercise, right? And then this is safety netting. If you experience any new symptoms, please contact us immediately and schedule a follow-up. So 3 things we always try telling everybody is to do safety netting, follow-up, and leaflets and pamphlets. Right, because even if you don't have time, try to incorporate these 3 things. It will always, somehow fetch you some marks, right? So safety netting is basically what to look out for. So you're looking out for some cardiovascular risk, right? So if you know the cardiovascular risk that can come with this, which is a heart attack or stroke. So talk about the features that can indicate that, any facial weakness or any arm or any limb weakness, or if you start feeling lightheaded, if you start having chest pain all of a sudden, make sure that radiates to the left arm. So make sure you come to seek medical help immediately. Yeah. Was that helpful, doctor? I'm just
Very
quickly making quickly list. So we have a 1-week plan for this, and I think we might be able to offer you a 40% off. In fact, that is something that we are offering everybody who have been attending these classes. So I'll just tell the moderator to just drop the 40% coupon. And if you want to take any personalized coaching, yeah, we'll have to schedule it beforehand because we usually are doing this, so we'll have to stop taking these normal classes and then schedule a personal mock.
One week preparation for the exam you said?
1 week preparation for you. You have 1 week, right?
Yes.
We have this entire workbench, which is only for 1 week. We have a module for that. So yeah, Dr. Rohit has dropped that special 40. You can use special 40 at checkout, and you'll be able to avail whatever price it is. You'll be getting it at 40% off. So you can check it out.
Much. Thank you. Really appreciate that.
No problem. It will be really good if you can go through some of the cases, and if you find it a little difficult to talk, try out the consultation guide, because we've made sure to incorporate all these languages in so this is something that we've made it run with the timer, so that you get an idea of where you are at every station. So if you see,
Begin. Enter the room.
it tells you what to do at every 30 seconds for this particular case.
Yes.
So
If
if you see,
your talk is good, if you practice talking, is good.
yeah, so if you have this in front of you, and if you want to practice with someone as well, it will be very useful for you to understand where you need to be and how to express yourself at that point.
Ask the group, if someone wants to join me, I will ask in the group.
Absolutely, sure. See, this one moves with the timer, like you see over here. You pause it, you can actually see the different things.
Yes.
All right, so let's quickly look at the performance. Today we had a very long.
Is it fair in this station or bus? What do you think?
So I would say that since you didn't do the task at all, so you will not pass stations when your task is not complete. You need to always do what is required out of the task. All right. You spent a lot of time in data gathering, but management was your main thing. You had to talk to him about the curious score. You had to talk to him about management, right? Counseling stations are basically managing cases. You have to counsel the patient. So yeah, let's look at that. So in the data gathering, you missed a couple of points, this was very important job lifestyle. Like, why is his BP high? You might be having a very stressful job. Summarize. That's actually a technique that we show people in concluding. Like, from what you've told me, I can see that you've been having a little stressful job, and that could contribute to your hypertension, especially when you tell him that his BP is high. For the reason supporting that, you can tell him that. And so I'd actually tell you to try some relaxation exercises that could help you in these kind of cases, and reduce salt and ramipril.
Is this my marking? Is this my marking?
So this is how Dr. Ibrahim has marked you, but yeah, I don't think he changed the mark. So depending upon the number of points you've been able to cover, you get this marks. But then I would still give you 2 because it wasn't structured.
Is this mark in all the station or the data gathering?
Is this station data gathering, doctor? This is just data gathering. This is management, and this is interpersonal skills. So even data gathering, it should be structured. You need to go from one area that you're trying to explore to another. You need to have an intention for asking the questions, right? It's a little more structured. I would actually personally reduce this 1 mark because I felt it was a little random, your round of questioning. So try to ask your questions with thought process in mind. And yes, explain all the tests that was done in layman terms, and explain the results especially. Yeah. So talking about BMI was also important, which was also given in the task that this was also done. So tell him that his BMI was a little high. I think it was 28 or something, right? Yes, 28. So you can actually talk to him, telling him that the BMI was also high, and curious score is also not normal. So a couple of tests that needs to be done even before starting statins, even before starting ramipril, even LFT, RFT, blood sugar, and CKS kind of need to be done. So you can tell him that I'm going to give you these medications, but you need to start a few tests before you that. Diet changes, yeah, reduce salt, saturated fat, eat more fruits and vegetables. Yeah, in your diet you can actually incorporate those things, because those are the management. Cooking is not the management here, right? I would actually tell him what comprises of a healthy diet, recommending more physical activity, ramipril that can be given, which can cause cough. Whenever you give a medication, you have to also tell them their potential complications. That's also very important. Monitor kidney function tests due to medication, offer leaflets, schedule a follow-up, watch out for warning signs, that is safety netting. Couple of interpersonal skills: do not manage so could not exhibit more interpersonal skills, right? Acknowledge positive efforts they're making in managing their condition. So whenever they say something positive, I try to do something. Always encourage that. Like that's a good step actually that you're taking towards your health, right? Avoid medical jargon. Yeah, you never really got to the point of talking about Q risk and all that. Pause frequently to check understanding. That's very important. You're just talking in a breath. You have to understand if they're understanding what you're trying to say, right? Maintain professional demeanor while being approachable and kind. Provide clear advice on where to seek further help, and offer additional resources like leaflets to support groups if relevant. All right, Dr. Nasser, that was actually a good attempt. I hope this session was useful for you.
Yes, it's very good, really.
Absolutely. Good job then. Well, I guess we'll call it then. Thank you guys for joining for today's session. We had a great participation from all of you. Thank you very much.
Thank you.
Yeah, that's all, because he's actually come for routine. You can also understand that he's not had any disease. He's just come for routine screen. So just ask a few questions and go on to understand a little bit about his lifestyle, because that's where you will find the clues in this particular counseling case. This is counseling lifestyle. So mainly, yeah, look out for the task that you needed to do. All right, guys.
History and start in. I skip history, and I in this like family history.
No, you cannot skip it, doctor. I think it's very important.
Absolutely, it is very important, because what if this patient actually has a history of familial hyperlipidemia? That is a very important history that you cannot miss out, especially when you're prescribing statins, right? Those history is very important, doctor. Even family history, you need to understand if there are any cardiovascular risk. What if somebody in his family has had a cardiovascular risk at below the age of 60? That's also a very important risk factor that is calculated in the Q score. So you need to understand.
Okay.
Yes, doctor, you want to say something?
Okay, I understand.
Awesome. Exactly. That's the thing. You need to understand what all are the important questions to ask. You need to understand your clinical judgment in order to ask that. Yes, Dr. Esra, you want to ask something?
No.
Awesome.
So I think this, it means going forward we should all try to really understand our question. Like, I'm making reference to my case that I presented, because it was a bit tricky for me. I didn't really understand it. So it's like that same approach could be applicable to this case now. Like, why did they have the test done in the first place?
Absolutely.
Because
That's
they didn't have it, then you want to probe for symptoms, because hypertension, all these things are silent killers. They might not give you anything. So you're trying to rule out red flags and things like that, which he beautifully asks. Maybe headache, heart racing, dizziness. Okay, then you go into the lifestyle. So, and while we're doing all that, we should be quick and use short, more focus, and don't use lengthy words, because I'm also a corporate to that. I'm trying to get better. Maybe there are better ways we could say it. Okay, a bit about your general lifestyle. Have you been diagnosed any medical condition, any medical condition and heart problem in the family, or any medical condition in the family you think I should know? No. Okay, what do you do for living? Do you smoke? Do you take alcohol? What, you understand? Things like that. Then we go a bit about your social life. Do you drink? Do you think? Because this case, like understanding the case, you say, okay, this is more of lifestyle problem, and then we go into it. So it's one thing is understanding the task, and then another thing is how to approach it, which we are all still learning. For me, myself, this is how I see it, but I stand to be corrected. Like today has really helped me.
That's some keen observation. Good job. And every day we are learning. So always keep your.
And again, in history taking this kind of cases, something we didn't ask in the body of the history, if we're discussing it in the management, even if we say it, well, I think they might not mark us properly, because they'll think we are confabulating. Because for us, the history is important. That is asking those positive things, like the diet, the the job, because you want to know if the job is stressful for him.
Yeah.
Who does he live with? Are they supportive? In terms of his food, his wife, instead of saying you have to cook your food on your own, yeah, things like that, we just incorporate it and make it. The most important thing is for us to flow, use lesser words, but pass the message across. We are all learning. For me, I'm just telling myself this is what I need to improve
This
on.
case, can you refer him to dietitian?
Yes, doctor. I
Yeah.
mean, that's something you can do. Yeah, I mean, if you think that that is useful.
And over time, I will refer you to the dietitian to discuss with you healthy food and healthy to eat.
Yeah, not bad. That's also something you can do. I'll refer you to the dietitian so that they can recommend you, diet that could, improve your health. In those ways, like because he's also been diagnosed with hypertension, he needs to reduce salt also. So the dietitian will be in a better position to put that in. But cooking your own food is very ambiguous. Like what you're trying to tell him is to eat more fruits and vegetables, reduce trans fat. You're supposed to use these words. Cooking your own food may not mean that they are actually eating healthy still. That's what you're introducing a lot of
I say you have try to cook yourself healthy type of food. I should say that.
works. That works. Dietitian also works. So definitely, yeah, that's what now you're thinking. Now you're actually using your, frontal cortex and actually making those words come
Try
out.
to cook sometimes for yourself healthy type of food, like eating fish and fruits and vegetables like this.
Absolutely. All right, guys, I will have to call it a hard stop over here. So thank you so much, everybody, for joining. We've had a lot of great discussions today. And thank you, everybody, for your applauses and your
Very helpful. Really. Thank you.
Absolutely. No problem. Okay, then see you guys tomorrow. Bye-bye.